All right, so on Your Side Mirror this morning, we're going to be talking a whole lot about milestones, right? When you do something consistently for years, you are going to become an authority in that field. So this morning, we're looking at 40 years of healthcare, lessons, gaps, and the future of public health in Nigeria. And joining me in the studios this morning, a seasoned medical professional, Dr. Bola Olaosebikan, OON. He's a medical doctor, health strategist, and of course, publisher of Healthcare Magazine. And he's also a former commissioner for health in Kwara State, former commissioner for environment and tourism also with that state. I have the privilege of having Dr. Bola Olaosebikan in the studios. Nice to have you in the building. Good morning, sir.
Good morning, Mr. Victor Oteri. It's my pleasure to be here.
Long time coming, really. We've been having conversations for several years.
Yes.
But this is the first time we're meeting face to face.
Yes, face to face, live.
So
yes.
Look around. These are our studios. What do you make of the studios, by the way?
Great studio. Lagos Traffic Radio is one of the best radio stations in Nigeria.
Great.
And it's also the only one in Nigeria. You're a great state and great station and great experts here.
Great. All right. I'm not blushing, but thank you so much for the compliments. All right, let's jump in on the conversation. I know that we'll come to what you've been doing for 40 years. I've been a publisher of a healthcare magazine. But first things first, how would you describe the condition of healthcare and healthcare delivery in Nigeria as it is today? Talk to me.
Yeah, thank you, Mr. Oteri. It's a very important question. The healthcare system in the country and the healthcare delivery is developing gradually. It used to be backward. You remember in 83, a government said health in Nigeria is in shambles. And it went further to say that even the clinics are consulting clinics.
In fact,
hospitals are mere consulting clinics.
I remember that broadcast. That was from General Abacha.
Abacha, 1983. And we were on that road for quite a long time. And then I started healthcare in 1986, exactly 3 years after that declaration of health in shambles in Nigeria. I didn't want health to be in shambles in Nigeria, and I started that publication to educate, to advise people and even government to motivate them to give priority to healthcare. Healthcare should be first in any nation that is serious. It should be first, both in terms of infrastructure, both in terms of workforce, both in terms of technology, management, and funding. Something has been happening in healthcare in Nigeria since that time. In various states, they are doing some good things. Federal government also is doing good things.
Right.
And we're having the growth of modern medicine and the growth of complementary medicine.
Yeah, we'll talk about that even as the program moves on, because I know you're also a consultant when we talk about herbal medicine too. But in terms of adequate numbers of medical professionals, to be precise, doctors, for instance, in treating patients, what are we seeing over the years?
Thank you. The trend is quite challenging, and these are areas where there are gaps in healthcare in Nigeria. And most crisis is leading to what is called Japa syndrome. Nigeria has lost more than 20,000 doctors going abroad. Most states are chronically have shortage of doctors. What we call the medical workforce. Without the workforce, the healthcare system cannot have any force. So this is a challenge. Manpower is a challenge. Nurses, doctors, pharmacists, they are going abroad in drones. And the number of one doctor to 60,000 people cannot be met now in Nigeria. There's too much gap in manpower sector.
And is there any end in sight for this Japa syndrome for medical professionals?
Well, I have a 10-formula solution to Japa syndrome in the new book that will be launched. There's a 10-point solution that if it's applied, we can reverse Japa syndrome within 2 years. All
right, I'm sure you don't want to reveal that because we would like people to go there. All right, but what are the good things about healthcare in Lagos or Nigeria that you'd like to share with us this morning?
Yeah, great, Mr. Oteri. One of the best states with good healthcare in Nigeria is Lagos State. And somehow I partner and I've been part of Lagos State. In fact, I started my medical career in Lagos State in 1985.
Wow.
I was a medical officer in Lagos State. I was working in General Hospital, which is now Lasut. And each time I go to that place, I always remember where I sleep at night when I'm on call duty in a porter cabin inside General Hospital Ikeja in 1985 to 86. Good things are in Lagos, especially in healthcare. It's the best health system in the country. And I remember that when Governor Fashola was there, I partnered with Lagos State, healthcare partner with Lagos State, to educate people on Ebola virus and how Lagos State stopped Ebola from spreading to all the other states in Nigeria. If it was not stopped in Lagos, you can be sure that Ebola will be in many states in Nigeria. So Lagos State has a very good biosecurity system, bio-threat. They have a good lab to stop public health epidemic.
Okay.
Especially when I came to your station and talked some years ago, maybe 5 years ago.
Right.
I didn't come, but we spoke
That's
on
right.
Radio FM. It was really radio talk.
That's true. That's very true.
And Lagos State stopped COVID-19 too, effectively in 2021-22. So Lagos State has a very good creative preventive system. They have an hospital for preventive diseases. They have a system that is well funded. They have HR and manpower that is very good. So that is the beauty of Lagos Health.
So those are the good stories that at least you can talk about in these 40 years of your adventure in the public health sector, right?
Yes, certainly.
Okay, so I know that one part of you is also very much in herbal medicine, so to say, and you're a consultant there too.
Certainly.
How do both sides marry? How do you marry both sides?
Well, I want to share a proverb from our late legend, Bashor Remke Abiola.
Yes, who coincidentally today is his birthday.
Today is his birthday. Happy posthumous birthday to a legend, the father of democracy in Nigeria.
Right.
He said when he was campaigning, he came up with many proverbs in 1993. So many. One of it that is relevant to this discussion is that you cannot clap with one hand.
That's very true.
You need two hands to clap. So orthodox medicine is going on for a long time. The gaps continue to exist. We now have to add the herbal medicine, which is also sometimes called alternative medicine. So if you're want to clap with the two hands, if you want people to really be healthy in our country, we must continue to improve the orthodox medicine that the colonialists brought to us. Which we are still sustaining. But we must reform it. So we must reform it in terms of content, in terms of systems, in terms of services. And the services that is missing is the integration of natural medicine to herbal medicine. But I want to commend the federal government too. They have recognized it. They are not only Nigeria that has recognized traditional herbal medicine.
All right.
WHO too has recognized it, that it is essential, it is part of modern healthcare that should be encouraged.
So let me ask you now. So are herbal products, are they safe?
Very safe from my experience. I have done a lot of research, and we have got many gone through NAFDAC. They are safe. They are even safer than orthodox medicine. There are no side effects with herbal medicine. Herbal medicine. The most important is the production process must be scientific. It must be scientific. You must remove toxicity. You must remove infection, virus, and all that. And NAFDAC has standardized the way to have your product approved. You have to get it tested properly, and then you have to do pharmacological testing, this and that. And NAFDAC will standardize you, and once they standardize, it is safe. Any herbal product that is listed by NAFDAC is quite effective, it's safe, and the production is what is important to make it safe. So
Nigerians should stop discriminating against herbal medicine. Is that what you're saying?
Yeah, I'm saying so that if it's registered by NAFDAC, Nigerians should stop discriminating.
All right.
They should go for it.
All right, Dr. Olaosebikan, 40 years ago, you started this adventure of going into publishing, right?
Yes.
And you came up with the healthcare magazine.
Exactly.
What inspired you to start a health magazine in 1986?
Yes, thank you so much. Just like yesterday, it's 40 years now. I had an hospital then, and each time in my hospital, people come in and they are going, and I say, this is where I'm bringing disease. They are going by with drugs. The medical system established in our country by the British people, the colonialists, is the disease and drug medical system. And you go to hospital, you collect drug, but the disease is still in you, or it may be suppressed. The only way we can break the cycle of disease hegemony is through information. Knowledge is power. It's missing in the health system in the states, in the federal, in this country. Health information is missing. They are only building hospitals, biomedical equipment, capital expenditure. IEC is not promoted in Nigerian health system. Information, education, and communication.
Right.
That is what God told me to start. In 1986, in my hospital, when people are coming to collect medicine, people even told me when I started the magazine, they say, "You don't want to have money. Why are you educating people?"
Wow.
I replied and said, "How many people do you want to treat? How many do you want to treat in a day, in a week, in a month?" Look at the population of Nigeria, 200 million people.
And where was your hospital at that time?
was at Olowu Street in Lagos.
Right.
I'm a success story of Lagos State.
Wow.
It's Olowu Street, 35 Olowu Street. Each time I pass that place now, I always say, this is where I started. I should have bought this building.
Wow. Back then. So looking back now.
Thank God that people that are genuinely serious about health and helping humanity supported me. Professor Ransom Kuti was the Minister of Health that day.
Very true.
He was the chief launcher.
Wow.
Dr. Koye Majekodun, the first Minister of Health in Nigeria, and the father of modern primary healthcare, private medical services, Nicola Hospital.
Right.
And the administrator of Western Region. They came. They were at the launch in 1986. I'm surprised nowadays you call people, they don't come. I always wonder, what are they doing? They don't come. They don't even reply your letter.
Wow.
I always laugh. When I wrote Mandela, he wrote me.
Wow.
I'm surprised when I write letter and people write letter today, they won't reply in government.
Which is quite unfortunate.
Very
really.
unfortunate. But Anthony was there. Taisholani was there. Adefokwe was there. These are the people that came that day, January 29, 1986.
And these are the prime movers of back time.
They had the prime mover.
All right. So, Dr. Olaosebikan, so looking back at the side mirror now, 40 years back down the line, what were the top 3 public health challenges in Lagos then, and how many of them are we still battling with? Let's just reflect a bit, 40 years down the line. Top 3. Can you just think back?
Top 3. Well, thank you very much, Mr. Terry. One of it is the issue of environmental health.
Okay.
A lot of diseases comes from environment. It's man and environment. And we had so much to do with waste disposal and the problem of contamination of the water system. But Lagos has done well, especially the president when he was governor. He started a lot of programs to clean up Lagos, and Loma was reinvigorated and strengthened.
Right.
And up to the local government level, they must continue to be serious about environmental health. Disease, a lot of disease comes from the environment. The water we drink, the food we eat, the air we breathe. All these sometimes are polluted. So that is one challenge in Lagos State, to manage waste very well.
Okay.
To practice what we call One Health.
Right.
One health system. And the second thing I will also say that was a challenge was the issue of infections, Ebola, that came to Lagos State in 2000, that broke out through a Liberian that came to Lagos. And we lost one of our greatest doctors, Dr. Adadevo, Mrs.
Very
Adadevo.
Very true.
He's a grandchild of one of the Nigerian pioneer, late Abat Macaulay. He's a grandchild.
Wow.
And then the COVID. These are the 3 challenges that I can remember that.
Yeah, but
I would to shake Lagos,
which is very true. Those were one-offs that really came on and did it. But in terms of diseases, I mean, or in terms of conditions that are remain prevailing, back then, did we have hypertension? Were they as prominent as loud as it is now? Hypertension, was it there like we have now?
Certainly, Mr. Terry. It has always been there. We call it the silent disease,
right?
Silent killer. If blood pressure is checked for people from time to time, you find out that you don't even know you have a silent killer. You are working with it everywhere. Especially men, they get home, and then people should stop using analgesic so much. Anytime you have a headache, people rush to chemist and buy and throw into their mouth. You mean it's wrong? You are suppressing the pain. The pain is a signal. We call it symptom in medicine. It's a symptom. Anything discomforting you is called symptom. I'm headache. I can't sleep. These are signals that you should go and do a proper checkup. Hypertension is so prevalent in Nigeria and in Lagos State.
Right.
Malaria is also a very, very serious problem for Nigerians.
And it still remains with us, right?
So these are diseases that diabetes is there, obesity is there. So these are the challenges. They are common and they could be prevented. Can I say it can even be eradicated?
Right.
Totally.
All right. So, Doctor, I know you've been a pioneer in preventive health and, of course, herbal medicine.
Certainly.
So, when you started so many years ago, so let's reflect a bit now. Has the message, has it really changed in terms of communication, or perhaps the attitude towards this kind of ailment, and, of course, the attitude towards preventive medicine? Has it changed over the years?
Well, I told you that the change is ongoing, but it's not as massive as it should be. For example, I had also worked with the president when he was governor in Lagos State. I was member of the transition committee in 1999.
Oh.
We worked on the health policy with Ransom Kuti, 19 of us. But the president loved talent.
Okay.
As soon as he became governor, he set up the Lagos State Management Board and brought some of us in. I was in charge of Gbagada General Hospital, that is now big for Lagos State University Hospital. I was the chairman of that hospital.
Oh.
I was the chairman of Ikorodu General Hospital. I used to go to Ayongboni Palace. I was the chairman of Ijede Health Center. I was the I worked hard to make sure we establish a health center in Imota. There was no hospital in Imota. There was no health facility. The Oba told me, Baba Ranudu, Adibade Bakari Agoro, His Royal Highness, said, board member, please, my children at night, when they are going to maternity, some of them, things happen on the road at night. There's no health care, only tax office and maybe where they give vaccination to children.
Right.
We worked very hard and the governor approved establishment of the hospital. Another thing I saw about preventive health is that availability is very important. Many areas we still need to have a health map and know the distance between people and distribution, and then the emphasis of bringing big hospital is not necessary. We should have small hospital everywhere.
Okay.
Not far from people's home, not far from schools, not far from industry, but big hospital, 300, 400, 500 beds. When I hear 400, 500 beds, are they playing for people to be sick?
So when you say small hospitals, are talking about how many beds?
Maximum 20.
20 beds.
Maximum.
So we should have that in all local governments?
All local government, all wards.
Okay.
We should have. And the issue of preventive health is also very important. And it also come back to IEC, Information, Education and Communication. As chairman of the Ikorodu General Hospital, I noticed when I was there in the 2000 to 2005. So people used to run from blood transfusion. They said they would die. So we launched a program called Save Blood Donation Campaign. It's an agency in Lagos now.
Right.
Not just putting blood in blood bank.
That's the Lagos State Blood Transfusion Service.
Yes, we created it from Ikorodu, and we said people should donate blood. Men used to run in Ikorodu. Maybe they have stopped doing it, or in other part of Lagos, Nigeria. Our behavior is the same. Health-seeking behavior is the same in this country. We call it health-seeking behaviors. People run from donating blood, and that's why Tout used to sell blood around hospital, but Lagos has wiped it out. But it was through education. We launched a campaign which the governor approved. The Kings, the Oba of Ikorodu division came and attended it.
Wow.
And we now told people that even when you donate blood, you won't die. Because each day you have an accident and you are bleeding, your body is used to losing blood. So it will not collapse. But I want to donate blood. It's just the body will go into shock.
Wow.
So the message was passed. And people started, when their wife in the hospital in Ikorodu, they would disappear for 3 days because they don't want to donate blood. Fear that if they donate, they will go. After that campaign, supported by the state and the local government, that changed and the blood donation become an agency.
All
so
right.
Education helped to solve that problem. We should launch campaign on education on many diseases. Government alone cannot do it. And that's why we are always talking about public-private collaboration. Public-private collaboration.
Which is very, very good.
And preventive healthcare is the best and it's cheaper. It also lead to what I call healthcare democracy. You must democratize the health system.
All right.
Cannot continue to pump and be like doctor, nurses, pharmacists to the people. The people have knowledge. The people have capacity to help themselves.
Which is
the people are not empowered. That is one of the message I have.
All right then, Lagos Traffic Radio 96.1 FM. If you're wondering who's speaking with me so eloquently this morning, is a man who's been there, he's done there, and I can tell you, we are really sipping from his pool of wealth, especially in the medical sector. I'm talking about Dr. Bola Olaosebikan, OON. He's a former commissioner of health in Kwara State, also former commissioner of environment and tourism for that state. Currently, he's the publisher of a healthcare magazine, a magazine with a milestone of 40 years in existence. Let's get back to the roads. We did tell you that we had 2 high-capacity buses broken down. That's around the Majidu inwards Mile 12 corridor. Control room can be posted. What's the latest with that? I need an update as relates to that one. Abule Egba corridor, peaceful protest ongoing underneath the Abule Egba Jubilee Bridge. And I understand it's affecting vehicular movement as we speak right now. Backlog is on the increase, both in and out. So control room, keep me posted with that one too. Around the Ogudu corridor too, we've told you that we have another articulated vehicle got stuck in a ditch there. Is loaded with plantain, I understand. This is at the toll gate inwards motorways. So that one too, very much on ground, cone positioned at the rear just to avert any secondary incident. Those of you heading to the island, the Third Mainland Bridge is still very accessible if you want to navigate through that corridor. And of course, the Ikorodu Road from Ojota heading towards That's Odoyalaro proceeding through Maryland. Things are still looking good. But a fresh update coming in now from Adeleye from the control room says there is a BRT. This is around the Ajasa command end. Let me see. Yes, that's Ajasa command. It's a BRT bus with a mechanical gear problem, occupying 65% of the road inwards. This is inwards where now? Okay, Oluwa. Okay. Oluwa Gani Toto, right? Nitoto, all right, okay. That's at the church roundabout there within that particular corridor. I understand last mile officials are documenting the incident, and of course, we have some reflective cones strategically positioned, ensuring that we have some organized movement around that end. Driver already contacted, and of course, the bus is will still receive some attention in terms of repair works. All right, then Lekki Ajah Corridor 2. Okay, I understand there's also another peaceful protest ongoing Ajah underneath the Jubilee Bridge by Association of Lagos State Pensioners. All right, Lagos State Pensioners, they're having a peaceful protest, and I understand it's not really affecting traffic in any way right now. Okay. Association of Peaceful Pensioners, they're doing their thing around that particular corridor. All right, then, if you want to join the conversation, you want to speak with Dr. Olaosebikan as we talk about this milestone of 40 years in the saddle of, doing communication in terms of healthcare and public health. Feel free. Hello there, good morning. Hello, good morning.
Good morning, Otumba Victor.
Yeah, Otumba Ayinde, I suspect.
Very well and okay, sir.
All right, so how are you doing?
Very well and okay.
Okay, so where are you on the road, Otumba Ayinde?
Presently, I'm on Ogunusi Road.
Ogunusi, and what does it look like there?
It's still very, very okay.
All right, let's hear from you.
We're down towards Excellence Hotel, still very okay.
Good. Let's hear from you.
My guy in the house.
Thank you, good morning.
First of all, I wanted to say, from my own end, I'm giving you Otumata to add into your name, plus the O and which you already have.
Thank you.
Malga, this is the kind of orientation we wanted to be listening to. You have really, not only me, we have lots which you have given good lecture to regarding, for like me now, regarding what you said about the donating blood.
Right.
I have never donated the blood before. So now, from what I heard from you, I can promise you that by next week, I myself will be in general hospital.
Wow, that's good. Thumbs up for you, Ayinde.
Thank you.
This is compelling. So now you have the good news on radio and you want to take action. That's what he's trying to do this morning. And we really, really want to appreciate you, Ayinde, for making that effort. And I'm hoping that other Lagosians too will join. We'll still talk about his book. He's launching his book very, very shortly. We'll still talk about that. But you can join the conversation 080-99-120777. Dr. Olaosebikan, his order of the Office of the Niger, right?
Yes, please.
OON.
Yes, please.
That's a National Merit Award.
Yes, please.
Which year was that?
2004.
Wow, that's such a long time.
22 years ago.
Such a long time indeed.
Due for more.
You're really, really due for more, really. That's very, very true. All right, then 080-99-120777 and 09153-877127. This one says, good morning, sir. I remember when government hospitals were the first place many families went to. What changed over the years? Nathaniel is sending this one from Ishaga. But let's take this call. Hello there. Ooh, all right. That network did not allow that. But keep trying. So this Nathaniel is asking what changed. Government hospitals were the first place people went to. But now it's not the same.
Yeah, certainly it's a good observation. And what changed was the priority that is given to any sector. Then the health sector received more priority in distribution of resources. More was given to health, and more manpower were available. And of course, the idea of fragmentation has affected public health in the country. Most government hospitals are fragmented. You have eye care, this, you are paying for this, you have lab here, you are paying for that, drug is, you can go to 6 places to pay in one day in a hospital. This fragmentation has affected people's morale. But if you go to a private hospital, you don't pay in 6 places. You pay only in one
place, and then they will attend to you.
And they will attend to you. But in the public sector, it's fragmented. You must deal with it.
Okay, I have another message here. This one says, sir, my biggest problem with healthcare now is the cost. A simple hospital visit can empty someone's pockets. How did we get here? Maiwa is sending this message. Thank you so much, Maiwa, for your contribution.
Yes, true. It's true. The cost of healthcare is high, and the government must subsidize the health sector. There's nowhere in the world where there's no subsidy, especially for health sector, agriculture.
So government must bring in levels of subsidy.
They must bring in healthcare, and the health insurance can be used to subsidize by ensuring that government pay percentage of the subscription so that to support the people.
Are people aware of the health insurance sector very well? I mean, it appears people are not really tapping into it yet.
Information, education, communication too is still not much. It's not there.
Okay.
It's lacking.
That one's still lacking.
It's lacking. It's been done like a closed thing. It's not supposed to be a closed thing. It should be an open thing. We have health insurance authority at the federal level, and every state have a health insurance agency.
All right.
They are doing their best. They are trying, but the mobilization is not enough. The mobilizers are not involved.
All right.
It's a closed business.
Let me take you
but
to...
it's very essential. It's the only way we can fund health very well. People will pay some, like insurance for your car. If you insure it for 1 year, you're allowed to drive that 1 year.
All right.
But if you don't insure your health, because you'll be sick and fall into
anything can happen.
You pay to what we call HMO, Health Maintenance Organization. You can check in your area wherever there's HMO, accredited by Lagos State or by your state. Then you pay to them. You go to hospital, is cash out of pocket is removed. You don't pay cash in an hospital if you are an insurance. Even if your bill is 1 million, the insurance will pay it for you. But if you don't have health insurance, you have a problem of 1 million. Where will you get? You go and sell your property.
Which is very true.
So,
all right.
So those are the missing gap too.
Let's take you way back in time now. So you were Commissioner for Health in Kwara State?
Yes, please.
Which years were that?
2003 and 2005.
Okay, so how was it during that period?
Well, it was great. We had more focus on health. We had a blueprint. Don't forget, I was here in Lagos with Asiwaju for 2 years in the Hospital Management Board. And
then you now left to Kwara.
Went to Kwara. I was invited.
Kwara was quite a big state.
Yes.
I'm looking at the map of Kwara, about 36,000 square kilometers.
Kwara is the size of 5 states in Southeast.
That's very true. So, how did you cope in terms of healthcare?
We had 16 local government, and I used Formula 16 when I was there.
What does that mean?
Everything I do must go to 16 local government.
Okay.
Data collection, data processing. I do that data governance. I didn't just do things because we want to, clap and sing. No. Is it necessary? What is it? Based on need assessment, based on data. My PRS department was very effective. Public planning, research, statistics. Very, very effective. If we are going to improve healthcare, you must base your activity on data. So we had the health map, and also I organized the first health summit in Kwara State since 1967. The state did not have a health summit. I organized the first health summit in Kwara State in 2004. I had a consultant from UK that worked with me, and we pulled the resources together. We also, from that health summit, we were able to come up with sustainable programs, so costed program. And then we had partners coming to support us.
I think the governor there was some Lawal, right?
No, this governor then was Saraki.
Saraki?
Yes.
Okay, so let me ask you now. So would you say that was it the then governor of Lagos who's now the president? Was it the one that nominated you?
Yes, was the governor of Lagos State, yes.
Okay.
Yes, I've worked very well with the president and as governor of Lagos State. And I'm inspired by his advice and everything. I remember that even when we were doing the transition committee in 1999, after he won, he set up subcommittee 23. I was the secretary of the subcommittee on health. Professor Ransom Kuti was the chairman. And we invited him. He visited all the 23 subcommittees. And in my own committee, he came. And we are bearing the same name, Bola. When he said Bola, I said, oh, God. He patted me on the back. He said, I'm hearing a lot of good things about you. Keep it up.
Right.
And he said so many things that when I hear him speak now, I said, Oga has been saying this since that time. And he used one or two words that I can never forget. And it's still lacking in the health system. He said we should improve the investment. He's a financial guru. He talked about investment. I will never forget that word.
Right.
He said we should invest in the health sector. We should improve partnership. We should improve everything, principles. Those are the things. In Kwara, we try to do many things. One of the things I also did in Kwara was the free eye care. We introduced, Lagos, we had Bola.
Right.
We introduced eye care. We must prevent blindness in the country. Many people are using glasses, which they should not use. They are going to optician, not ophthalmologist. People don't know the difference between ophthalmologist and
the optician, right?
And people are straining their eyes to read. You can use reading glasses. There are different glasses, not just all the glasses on people's faces. It's for reading. Some are for sight.
All right,
and things like that.
Lagos Traffic Radio 96.1 FM. If you wonder who's speaking with me this morning, Dr. Bola Olaosebikan, ageless. I call him because he doesn't seem to be aging. All right, there's a message here. It says, Dr. Olaosebikan, sir, why do patients sometimes spend hours waiting at hospitals before seeing a doctor? Felix is sending this one in.
Thank you, Mr. Felix. Your observation is genuine. It's one of the gaps in the healthcare sector. There are many gaps in the health system, and the only solution is clinical governance. The governance in the hospital is weak. In the clinic is weak. People staying too long in the waiting room. Waiting room in the clinic is too long.
Right.
And therefore, what can be done is to increase the number of manpower that is starting to people. And we should also integrate telemedicine. We should integrate digital healthcare. People do not need to go to hospital every time again.
Okay, so they can be attended to from the comfort of their homes.
From the comfort of your home, you can be attended to. You can even get your prescription from your home. So you can do diagnosis from your home.
So doctors of your era and doctors of today, how would you compare?
I know, it was it was Stone Age.
That's what you think?
No internet, no nothing, no smartphone.
But you coped.
We coped, and I give credit to our teachers and those who organized the medical training for us in those days. We were even taken to a place called rural area, so that in future when you graduate as a doctor, you will not be dependent on where there's light only. You can also work where there's no light. And we went to a place called Erua in Oyo State. I graduated from the best teaching hospital in Nigeria, College of Medicine.
Where's that? University of Ibadan.
Premier.
Okay, have my hand.
and before we graduated, it's compulsory. You must spend 6 months in rural area if you pass through University of Ibadan.
Wow.
That is to train you to be able to cope in case when you are working in future, there's no this, there's no light, there's no water, there's no. And so, but today, the doctors of today, the medical care of today, are having a lot of what we don't have. Internet, they have it.
Okay.
And they have GSM, we don't have it. So with those two things, we can practice what we call digital healthcare. You can stay in your home and consult a doctor. You just pay through health insurance and you quote the number, and you are not going to pay 10,000 or 1 million. You can be. There is solidarity of the money. Some people will pay, they don't use it. It is those who pay less that will use more.
All right.
People like Dangote, people like Bola, people like rich people, Folawi, all of that. Call on them to partner with the government to put down funds, health support fund for the less privileged. And once these people are registered, such money can be used to treat them. Every time there's a health problem, people will be raising funds, they'll be making, and there's no fund, there's no consolidated fund for that. There's no trust fund for that.
So you feel there should be a trust fund for health?
There should be a trust fund for health.
All right, more reactions?
There should be a health bank.
Okay,
there
more
should
reactions.
be a bank too for the health sector.
Which
people
is good.
Put money and then use it for health.
All right, more reactions coming in for you.
Also help the industries.
That's true. 08099120777. Doctor said there are so many Nigerian doctors and nurses leaving the country. How serious is this for those of us left behind? Sheung Ibrahim is sending this one in. Thank you so much, Sheung. So how serious is, of course, I know you spoke about this earlier on, those that are jackpotting. How serious is this issue for us that are left behind?
Thank you, Mr. Sheung. Thank you, Mr. Oteri. It is very serious. It's an acute problem. I will not mention states. Some states need 20,000 doctors before things can be okay. Just one state, and we have 36 states. Some states need 15,000 extra. So the gap is wide. When we talk of gap, this is it. Manpower gap is so wide. And of course, the morale is low. Even those who are staying behind is low. When you imagine somebody that is your colleague living and going to a place, and his first salary is like 1 year's salary in Nigeria. And in 1 year, he can build a house, he can buy land, which he cannot do in 10 years in Nigeria. So I think there should be a review of the payment system. There should be monetization. And then there should be what I call Work in Nigeria system. Is in my book.
Okay.
Work in Nigeria formula.
So let's talk about this book now. Now is the time to talk about the book. So what's the title of the book?
The title of the book is Making Nigeria's Head Great. You know, Trump said making America great. Me, I say make Nigeria's head great.
Okay.
Make Nigeria head great.
And when is this book going to be unveiled?
25 chapters, and they are, going to change everything in Nigeria. It's a model of all book for good health.
All right, just for 1 second. Flash update coming in from Leye from the control room. He says that peaceful protest around the Lekki Aja, that's underneath the bridge there. I understand the protesters have left that location, but guess what? Another protest is surfacing. This was a peaceful protest at Iyanokpaja underneath the bridge by the Association of Lagos State Pensioners. Another protest by another group too, but they are the same in orientation. All right, this one is at Iyanokpaja, so we have 3 locations now, though the one at Lekki Aja has left. All right, so you said that your book, Making the Health Sector Great Again,
yes,
is going to be unveiled when?
Tomorrow, 25th of August. Tomorrow. By this time tomorrow, they will have opened the. Where's that
venue?
It's happening at Lagos Airport Hotel.
Okay, Ikeja. Right here in Ikeja.
Yes, and we have invited the Honorable Minister of Health, Professor Mohammed Pate. We have invited His Excellency, the Governor of Lagos State, whom we are going to also declare as the best governor on health in Nigeria, on West Sub-Saharan Africa.
Wow.
We also have 3 or 4 other governors that, based on data collection. I told you the best evaluation should always be based on data.
All right.
So data has shown that there are 12 leading states in healthcare in Nigeria. Lagos is leading, and there are other states that we have recognized as leading states. 1 in each zone, and then we have additional states. So tomorrow, this book will be presented. We hope that the book will become a manual for health development in Nigeria. It is based on public health theories. It's based on public health system and analysis. It's not a book you can put down once you get it, especially if you're a health professional or a health developer or an investor. And also all schools of health technology, all school of nursing, or college of medicine should be applying the theory in this book and the knowledge that is being transferred to be able to transform the healthcare system in our country. It's not just the doctor going to become Dr. MBBS, which is disease and drug, but there is a gap. They must have this gap that is in this book, this information. How do we control the gap? What can we do to transform? And the financial system have a lot of work to do to partner with the health sector. All this JAPA and all that is because the funding is not adequate. It's always about drugs, about painting hospital. It's about buying equipment.
So who can be part of this tomorrow? This unveiling, the launch? Who can be part of it?
Well, the health sector.
Okay, your stakeholders in the health sector?
My stakeholder in the health sector, the government, because we're talking of public-private collaboration tomorrow. The public is the government, the health agencies, the pharmacies, the nurses, traditional institutions, because the health sector cannot grow without community mobilization. The community leaders, the obas, the traditional rulers, many have been invited.
So they're going to be there.
We're expecting them to be there tomorrow.
All right. So I wish you the best, and I'm praying that there's going to be another milestone. So this is 40 years.
It's 40 years.
So what do you expect in another, let's say 10, 15 years? Like I said, you're still ageless.
That's true.
Because I'm sure you must be approaching your 70s now.
Oh, yes, I am.
Okay.
I'm looking at the 7th floor.
Okay, good. So in the next 10, 15 years, what should we be expecting from Healthcare Magazine?
Well, quite a lot. We this AIC I've been talking about, we're trying to partner with people to institutionalize it. We want to have a center for health information and advisory services. We want to have it in pilot states. We'll set it up where people can have information, they can call us, they can have a reference, we can give them data. People who want to do research can also contact us or ask us to carry out some studies for them. Right. This must be integrated into our healthcare system. It's a big gap. We only have hospitals. We don't have information system. We don't have information center. We don't have advisory center. We don't have, it's too much.
Okay.
It's too much. So there are other things that we are planning which
will be part of this in the years to come.
Yes, the development for 5-year plan is already coming on, and some of them will be mentioned. I've mentioned some will be mentioned tomorrow. Okay. And then some are in the book.
Okay then. All right. I'm sure that means people should go out there and get this book. So after the launch tomorrow, where can people get the book?
From CSS Bookshop.
Okay.
And other bookshops around the country.
Okay.
And
All right.
it will also be available on Amazon worldwide.
Which is good. Dr. Olaosebikan, let me say congratulations to you.
Thank you.
This is a milestone indeed. 40 years down the line, you're still standing. And I can tell you, what you've been doing has been having lots of impact on the lives of so many people. So congratulations once again.
Thank you.
All right, we'll round this off right now. So
Thank you.
what's your parting thoughts to the listening public as we round off the program?
Yeah, my parting thought is that keep hope alive. We are in an era of renewed hope. We must keep hope alive. Whatever situation you have, the president said be hopeful. I joined the president too, whom I also shared the name Bola with. Be hopeful. And also be helpful to other citizens. Be caring for your health. Health is first in everything in this life. Make sure your health is number one of your priority and your concern.
All right.
And protect it, promote it, and enjoy it.
All right, then. We'll leave it there for now. It's nice having you in the building. Thank you so much for being here.
Thank you so much.
All right. So 40 years of healthcare, lessons, gaps, and the future of public health in Nigeria has been our focus. And I can tell you, Dr. Bola Olaosebikan, OON, medical doctor, health strategist, and of course, publisher, Healthcare Magazine, has taken us on this excursion. I really had a good time with him. Let me say a big thank you to Akan Hussein, who has produced the program this morning. In the studios, I have some interns: Aishat Salau, Favor Austin, Aishat Adigun, and of course, Helen Okuri. Not forgetting our social media guy, Remy Aluko, and Daniel Downsey, both of them making sure that things go on steadily behind the scene. Let me appreciate our executive producer, Tayo Akonle. My name is Victor Oteri. Have a splendid day. Bye.
Nice. I take it one. You wanna live long, you wanna stay strong.